Okay. Good afternoon, everyone, and welcome to the little session we have with regards to women leaders in pediatric oncology. I think we all accept that women scientists have led groundbreaking research across the globe and are powerful agents of change and are critical as far as leaders as well as decision makers. So some of us may not know, but one of the founding members of SIOP was Odile Schwiz-Guth, and she was one of the pioneers in pediatric oncology in France and opened the first children hospital for pediatric cancers in France. So the Women Leaders in Pediatric Oncology is a sort of a subset in SIOP, which was started in 2022 with the aim to showcase all the path breakers in the field and act and, to encourage the younger generation of pediatric women who take up pediatric oncology to be leaders in the future. So for today, we have two leaders. One is from Armenia, Dr. Lilith Sargsyan, and I think we'll all accept that we don't know how to pronounce other countries' names. So I welcome Dr. Lilith to give us a few words about her journey to reach where she has today. Dr. Lilith, please.
Thank you, Amita. Good evening, dear friends and colleagues, and welcome to our beautiful country. I am too emotional and I am so sorry. Thank you for coming and sharing your time for listening my story. By good fortune, many years ago, in 1992, in this hall was my first lecture when I started my long journey in medicine. So, being a woman leader in pediatric oncology, is it easy or not so? The decision to become a pediatric hematologist has a short but inspiring story. During my university years, I met a group of doctors at hematology center who had just returned from Germany. And this encounter led me to decide to become a pediatric hematologist. Armenia faced economic difficulties in the 90s as a result of various factors, such as the 1988 earthquake, the dissolution of Soviet Union, and the Artsakh War. These circumstances presented significant challenges for the country during that time. This was in 1995, a time when childhood cancer mortality was as high as 97%, and almost all children diagnosed with cancer were dying. However, with the investment of the latest treatment regimens in the treatment of pediatric leukemias, the survival rate reached 70% in a short period of time. Witnessing this revolution made me realize the potential of this complex and rapidly developing field. Despite the rapid development of the field, the economic crisis in our country made things difficult. At that time, the diagnosis of leukemia depended solely on morphology and cytochemistry. And treated relapsed leukemia and performing stem cell transplantation were considered unattainable goals. As a clinical resident at the hematology center in 1998, my path toward becoming a doctor began. But it was no easy feat, with long and difficult night shifts. It was particularly challenging for me since I already was a mother. The end of 1990s, Armenia faced a shortage of essential medicines and basic medical supplies, equipment, and even elementary syringes. Essential examinations, including radiological, immunohistochemistry, and genetic examination for diagnosis of solid tumors, were unavailable in Armenia. And we were fortunate enough to receive significant aid from the charitable foundation Hilfe für Armenien in Germany. Since the 2000s, radiological examinations became more available, and immunohistochemistry examinations became a reality. Working at Muratsan University Hospital, I had a chance to undergo various trainings in different countries and clinics. At the chemotherapy clinic of Muratsan University Hospital, together with a group of young doctors, with my friends, our aim was to establish the pediatric oncology field, with particular emphasis on treating solid tumors, as hematology was already comparatively in good shape during that time. Since 28, I have had the honor of teaching at the Yerevan State Medical University and sharing my passion toward my profession. Even the pediatric oncology has never been regarded as an attractive or profitable field. Even today, the most frequently asked question I receive is how I can work in this field. But my answer has always been that if not me, then who? In 2090s, an important decision was made for Armenia to merge 3 existing clinics and establish the Pediatric Cancer and Blood Disorder Center of Armenia for the provision of centralized care to pediatric oncology patients. And I was appointed to head the Pediatric Oncology Department. This is a huge responsibility in a small country like Armenia, where everyone knows each other. But it is also an honor for a woman in an Asian country to have such an opportunity for self-expression and self-development. And finally, I would like to conclude my speech by expressing my heartfelt appreciation to my mentors, teachers, colleagues, students, patients and their families, and of course, my family, who have supported and understood me throughout my 20 years absence from the family. Thank you for your attention.
Thank you so much, Dr. Lilith. That was wonderful. And it has been, you have really worked to make your dreams come true.
Yes.
So if we can say, I have a few comments, questions from the house. And I'd just like to ask you that since you were sort of doing your residency at the time of the war and earthquake, did that, be a big hurdle in your career? And sort of, you took up pediatric oncology. Was there somebody aspirational in your life, or you just kind of liked the subject?
Yeah. In 1988, I was a 14 years old teenager when earthquake was. I was in school, and I remember that many students from Gyumri and Vanadzor came to Yerevan, and particular to our school. Many different specialists from different countries, builders, doctors, also came to Armenia to support us in this terrible period for Armenia. And the children joined us for a short time, and I think it helped me to feel me as a point of international team. I realized that without international support, it would have been very hard to hear such a disaster.
Yeah. Thank you. Yes, please.
If by a miracle you can go back to your 25s, would you choose again this profession?
Yeah, thank you. Very interesting question, of course. For sure. I would choose the same specialty, of course, because of two reasons. The first, I met people on my way without whom I can't imagine my life. And the second point, I think, because it's very strange specialty, very hard, but at the same time very pleasure, because you know you help children to cure from this terrible disease.
Thank you.
Yes, please. Okay. Sorry.
Thank you so much for the wonderful speech. This time I don't have a question. Fortunately, we have this opportunity to ask a lot of questions daily. And so just one comment. You received the question, how we are doing in this field. And you said, if not me, who? So I have addition to that question. We also received this question. The great team helps us always. So having a nice team always inspires us as young specialists to go ahead. And I would like to also highlight your role in our journey. So and thank you for being such an inspiring leader for us. Thanks.
Thank you.
Can you give the mic this side, please?
Thank you very much for your interesting presentation. And I would like to describe you, dear Lilith, with two words. You are so strong and at the same time so soft.
Thank you.
And I think for me, it's one of the main points of the woman leader. And I hope to enjoy our collaboration. Thank you very much.
Thank you. Thank you so much.
Yeah. Any other thoughts? Yeah. Okay. So, if anyone else would like to say something, just yes, Dr. Ewart, please.
Just two words. I think, and I really mean what I say, and I think the women leaders are driving the world. And I can say that for sure, that if women lead in general the world, there would be no war and no disasters. And Dr. Lilith Sargsyan is definitely one of the leaders who are making a real change in our environment and making sure that everything smoothly goes forward without any battles, without that the progress continues. And thank you very much for everything you do. Thanks for being a great teacher, great friend, and great mentor, and just a great person.
Thank you, Georg. Thank you. And this is not only me, this is a group working, and it is honor for me to be part of this team. Georg was my best student, and now he's my best chief.
Okay. And on behalf of the organizers, I have the pleasure of giving you a token of appreciation from all of them. So, it's a great pleasure to request Dr. Mariko Kakuzu who is from Cambodia. So she is actually from Japan, but is now in Cambodia, and it's a real pleasure to have her with us. And we shall listen to her wonderful story as well.
Okay, thank you for giving me the opportunity to speak today. I have been working in Cambodia for over 5 years now as a staff member of Japanese NGO, Japan Health, to improve the survival rate in pediatric cancer patients in Cambodia. Today, I'd like to share what I learned throughout my career and provide advice to the next generation of pediatric oncologists. About my career, when I was 14 years old, my father died of brain tumor. That experience led me to decide to become a doctor to treat cancer. So I enrolled in a local medical school in my hometown. My hometown is Okinawa Prefecture, is located in most southern area of Japan, small island, but very beautiful sea and very popular, most popular sightseeing places in Japan. But in Okinawa, in the past, medical level is not good. So mainland in Japan, we are survival rate or diseases inferior to mainland of Japan. So I want to improve this gap between my hometown to mainland Okinawa. So I start working, and during my internship, I had a patient. He is 5 years old, 5 years old boy with brain tumor. I'm a medical student, so this was my first patient. So she's brain tumor like my father, so I'm like him so much. He's so cheerful boy. So after internship finish, I visit him frequently. But after chemotherapy, radiation therapy, and surgery, he died after 1 year. So his death was shock to me because my father also died of brain tumor. At the time, the pediatric oncologist in my university took care of him through to the end. So I made up my mind to become a pediatric oncologist to help patients like him. And after graduation, I chose to undergo clinical training at a famous hospital known as the rigorous residency program. I continue my training as a pediatrician in the same facility, become a board of certification pediatrician. It was a rigorous training program, but it allows me to acquire the fundamentals of clinical practice and provide me with the opportunity to meet exceptional many mentors. And I worked for 2 years at the cancer center and Children's Center in mainland of Japan. After finish my training pediatric oncologist, I returned to my hometown and worked as a staff doctor at the pediatric hematology oncology unit in my hometown. At that time, my hometown Okinawa medical level improving, so no gap between mainland of Japan. So at the time, I had this survival gap of childhood cancer. So in Japan, 80% patients survive, but in Cambodia and low limited resource settings, only 20% patients survive. So I was so shocked to hear that. So I decided to join. I want to improve this gap. So I'm looking for some area. I'm visiting some NGO who working in Vietnam or Laos or Cambodia and Myanmar and other countries. At that time, I heard about Japanese NGO starting new pediatric ward and start childhood cancer treatment in Cambodia. So I decided to join this organization. also. I decided to go to Cambodia, but initially I faced opposition from my family and my colleagues. Especially my family, my mom, my father died, so only my mom. So my family thought it was so crazy. So she said, "Oh, it's a volunteer job, volunteer work. So you are now stable job and you can earn money, but why you join volunteer work?" So, but I explain again to him, and we travel together in Cambodia. I show this hospital and the Cambodian settings. So after this explanation, they agree. She agreed with that, and I can. So I started my work in Cambodia in 2017. But when I joined an NGO medical activity in Cambodia, there was not enough infrastructure such as electricity, water supply, and road is not good in rainy season. Some road cannot use. And so in our hospital, we are located in the area. This is my hospital. We are located in rural local area, 1 hour from Phnom Penh. But every day we have electricity cut. No electricity every day. Sometimes we cannot do surgery at the time. But most of medical staff they are new and did not have sufficient experience. But nevertheless, by seeing my first time we didn't have pediatric ward, so I have to see adult patient and emergency case also. But I try my best. I see all patients who come to our hospital to build trust with local staff. And after that, we prepared for opening the pediatric ward. And we can open pediatric ward 2018. And we also visited other hospitals to collaborate. So we make a Cambodian cancer oncology group, CCOG, from 2018. We try to improve survival gap in Cambodia, all hospital in Cambodia. But now our hospital accept 100 cases per year. Survival rate first year around 20%, but now fifth year around 54% now. But not enough, but improving. And growth now. During COVID-19 situation, we have many difficulty times because before we have many volunteer doctors from Japan, special surgical team from Japan, and they teach our doctors, and they did surgery, and especially difficult surgery they can do. But during COVID-19 situation, they cannot come. So our staff, they try to their best, and now they can. Now local staff has grown, and they take care of the lead in providing treatment, including surgery. They can do surgery now. And this is my message throughout my career, and to my 25 years old, it's the following 3 things. So first, always choose the more challenging path. If you have a choice, choose the more challenging path. In my case, choosing rigorous training hospital and joining an NGO activity is challenging for me. But for me, even I failed, I have no regret. Please choose a path that you will not regret. And second, find mentors who suit you. It is very important to find a mentor who suits you. It's a good idea to find and approach a mentor who matches your personality, and even if it's not a hospital advisor, physical active in your area of expertise or medical professionals. In my case, my mentor, my supervisor at the training hospital, and my senior doctors, working for the same NGO, and Ms. Kazuyo Watanabe in Asia Child Care League, whom I often consult with her advice. And third, treat yourself like your best friend. Last, be your own best friend. Please imagine, would your best friend want you work hard and destroy your health? There was a time in my early 30s when I pushing myself to work all the day, drinking alcohol to relieve stress and making my health even worse. So by treating myself like a best friend, I have learned to prioritize and tackle things, spend time with my family and friends, and exercise daily now, and try to maintain my health. Please talk your best friend in you. Avoid pushing yourself too hard and take care of yourself. Finally, I would like to conclude my favorite saying from my hometown. Makoto usoke nankuru naisa. Do the right things and the rest will follow. Thank you for your kind attention.
Thank you so much, Dr. Mariko. That was absolutely wonderful. I think all of us who do pediatric oncology go through a lot of heartache because we accept the fact that we cannot cure every patient. We lose some along the way, and we have to smile and go on. And I'm sure all of us remember all the ones we have lost. And your journey, especially, obviously with your father and the first patient you had, has, probably been a big thing in your mind to take up oncology. And we also, I think I'm all admiration for the fact how you moved from Japan, which is a high-income country, and with all the facilities available in Japan, you have chosen to go to Cambodia and do so much work where there was practically nothing, is, I think, absolutely inspirational for a lot of us. And with this, I open this for any comments, thoughts from the rest of the audience sitting here. Yes, please.
Hello. In your dark days and your rough time, what makes you keep going?
Oh, thank you for your question. You mean the dark time? When my dark time, how to overcome it?
Like you had, for sure you had a rough time. You are far from your family, your country. You lose your father and your first patient. So what makes you keep going during that days?
So it's difficult. You're away from your family. You're in a different country. Yes. So when you've had a difficult day or it has been rough, what, keeps you happy and remember that the next day is a better day? How do you, be your best friend? How do you be your best friend? I think that's how you would like it.
Best friend. So first, I talk to myself as a best friend. When I'm a best friend, how my best friend how advise me. So I have my weekly meeting myself because like a best friend. So sometimes I'm so depressed when my patient died or something. So in the case, also sometimes I work hard too much. In the case, so I try to treat myself like my best friend.
I think everyone would say that they sort of introspect and, with some friends, somehow manage to come through it. Okay, Tessie and then Scott.
Thank you very much. I would like to know more about your advice on how to find mentors.
how to find mentor. Sometimes to find a mentor is difficult. For me, I decided to be a pediatric oncologist at first, but no, I have some male mentor, but the female mentor, like, I couldn't find female mentor at first, but when I join academic meeting inside Japan, or when I join another conference or academic conference, I can I hear some lecture from them, and at that time I can find my mentor first. So mentor not only inside the hospital, so it's better to go out hospital and communicate with others actively to find your mentor.
Scott, yeah? Oh, okay.
Dr. Mariko, I'm Tamara from Serious Mal Foundation, Armenia, and I want to say a special thank you for sharing your challenging journey of becoming a pediatric oncologist, and thank you for taking care of all those kiddos fighting cancer in your part of the world. So, I want to also share a very personal thank you for raising awareness on the issue of self-care, because it's one thing that I think that professionals in the pediatric oncology field need to hear more about, because I've been witnessing some burnout, I mean, in my personal life also, and thank you for bringing up that issue. And thank you for everything.
I think it's important. A mentor can be anyone. It doesn't, it can be your teacher. It can be someone you met when you were a child, anytime in a school teacher, in your college, wherever you went. It could be a family person. It could be your friend, colleague. Anybody can be a mentor, it would be more like someone who inspires you and brings out the best in you. Or even a couple of words they say, which is, helps you kind of find your way or make you realize you don't have to think too much to make a decision. And like you said, treat yourself and do what you think is correct. So we often think that a mentor is somebody senior who's going to tell you X, Y, Z, but it can be anyone. One can have a lot of mentors. It doesn't have to be one. And I would think it is someone whom you really trust and someone who you know has your best interest at heart, right? And the second thing is, I think Dr. Mariko and what you echoed was that all of us have to learn to look after ourselves, which is a fact. Forget about pediatric oncology. I think doctors often don't look after themselves. We forget, not only physically, like for example in our hospital, a lot of us forget to do our own medical checkups, and we're always telling everyone else to get their medical checkup done. And mentally, yes, we are in a field which is extremely taxing, painful, and emotionally draining as well. So we have to find some way out. Everyone has their own way. Some people do exercise, some cook, some run around, some talk, some dance. So everybody has their own method of doing it to remain happy. We all have to remember to remain happy and move on. Scott, please.
I would like to invite everyone to stay for the next session because Dr. Mariko is going to speak in a longer format about her journey and about her work. And also the SIOP Global Health Network is the place to find these mentors. Because maybe they're not even in your own country. That's okay, right? We're all here to support each other. And so, in fact, sometimes outside the country, they can give you a really clean perspective. So I would love it if everybody could stay for the next session where she'll be closing us out.
This is on behalf of the organizers of SIOP Asia. It's my privilege to give this to you. Thank you so much. Anybody would like to share something, we're most welcome. It's an informal session. So, if not, then I thank you all for coming. And we hope to see you at the next WLPO session as well.
Great honor to introduce you, and thank you for accepting our invitation.
Thank you so much for having me. This has been terrific. I'm rating this Congress 5 stars so far. What do you guys think? How many? Yeah, at least 5 out of 5. So here's an example of everything that Mariko said in the last session is what is the summary of my whole life. And this was supposed to be a career development discussion, but I don't like that because then it's like the old guy talking about his own life. So I wanted to show you something. This slide here, what does it say to you? You see that and what do you think?
There are too many affiliations, you mean?
Yeah, too many things, right? So you could think, oh, he must be important. That'd be nice. That's why I did it like that. But the other way to think is it's just too much. And so now I went from that to just 2. And that's what's really nice. It's fun to do 5 things, but it's not sustainable, right? As my best friend said, my best friend Scott Howard said, that's too much, because what happens if you do too much? It means you lower the quality of each thing. And low quality is not so good, right? So you want high quality of a few things, which now we're going to see. And the first thing I want to tell you is that systems are better than goals. So a goal is, I want to lose 10 pounds. Be good, right? That's a goal. A system is, I'm going to exercise 20 minutes every day. And I can do my system every day. Maybe I don't lose 10 pounds, maybe I do. But I did my system, I improved my health. Or my system is, I'm going to not get the ice cream there. Every day I'm going to walk right by and wave and not take it. That's a system. So you can do your system every day, and it means every day I can succeed at my system because it's something easy, it's feasible. Whereas losing 10 pounds, you fail, you fail, you fail, you fail, then you finally lose 10 pounds. You succeeded for one day. Then what happens? I should lose 5 more. So fail, fail. So it means every day you're a failure. And maybe one day you have one success for one day, and then you're a failure again. But following a system, you could succeed every day. It gives you energy, it gives you motivation. I did my exercise, I succeeded. You know, like you're saying, if you go exercise, you feel happier also. So it's not just success, it's happiness. Or you talk to your best friend, you know, I'm going to adopt your strategy immediately. I was just telling myself how much I'm enjoying being here with myself and with all of you. So it's really good. So this book, I hope you'll read it, How to Fail at Almost Everything and Still Win Big. Look, I can even point to it over my head. So you got to read this book because basically it's the story of this guy's life. Failed at this, failed at that, got left his bank job, failed. Next thing you know, now he's a rich, famous writer of books. And so he succeeded in life even though he failed at many things. And when you're thinking about pediatric oncology, many of us will write a paper sometime in our career. How many of you have written a paper so far? All right. How many have never written a paper so far? How many prefer not to listen to lectures in English? My Armenian is worse than terrible, so I'm saving you. So when you write a paper, the most common result is failure. You write, you spend hundreds of hours, you send to the journal, rejected. Then you rewrite, you send, rejected. Maybe they say, rejected, but thanks. Slightly better. The 4th time, maybe accepted, change everything, and we'll think about it. And then usually by then you say, forget it, it's in the drawer. I have things in the drawer from 20 years ago. Failure. So, but you can fail at almost everything and still have a good life. And that's what I want to point out here. So the second thing is to align with your own core values. Because if you have a value and you don't follow it, like let's say you value honesty and you lie all the time, you're not going to be happy, right? If you value lying and you lie all the time, it could work. But if you value honesty, you've got to be honest because then you'll be aligned with your value. If you value the life of a child with cancer in another country and you move to that country and start treating them, you're aligned with your own values. It's like having a nuclear power plant inside you that gives you energy. So that when you think something bad happened, the patient died, something bad happened, the best nurse quit, something bad happened, something in my personal life went bad, but that nuclear energy just keeps burning and burning and burning because you're doing your own value. What you know is important, you're doing it, and it gives you power. And the third thing is to consider time and energy and to think about why. Like, okay, I'm sitting here, why? Why did I come to Armenia? Mostly because I wanted to see you and meet your friends. So success, right? My system is working because I came here to see people and meet people, and that's happening every hour. Successful system. And I have some goals also, but those are not the important part. I'm not even going to share them. So then the why. Why do you want to meet the people? Well, maybe you can make a connection and actually help them with their career and maybe do something together in Cambodia. Who knows if maybe Cambodia's children will be better off because of the people here who are going to jump in and support our colleague. So here's a question for you. So it's a question and then you answer. Oh, improvement in what? Oh, all right. I think that is good. I said that. But let's say everything I do is childhood cancer. So if I improve it, I'm going to save lives. What would be a second thing?
To learn something.
Learn something? And why do you want to learn something?
Like to grow in a better way. Like to grow as a better person.
Ah, and then when you're a better person, what will result from that?
Like I could help someone, like the people around me.
Ah, see, she said number 2. Save lives, right? Because if you're a better person who's helping people, you're going to save lives. And what about some other ideas? What's number 3? To become rich, all right? So what are you going to do with your money? Oh, you're going to save lives. Maybe help build up the hospital in Cambodia. Yeah, why does anybody want to be rich? Oh, never mind. There's lots of reasons. But let's suppose you really wanted to help people. And if you're rich, you could help more people. And in fact, when I was in training as a resident, a fellow we call it, when you finish your pediatric, you do oncology. And I was at St. Jude, and I wrote a paper with Dr. Pui, who's my mentor for many years, really great mentor. And after the paper was accepted by the journal, he offered me a job. And so it wasn't a system for him, it was a goal. If the paper gets in, you get a job. So he wasn't teaching me the right way. But anyway, he offered me a job, and he said, if you stay with me, I'll make you famous. And I said, well, I'm not really so interested in being famous. I want to help people. And then he stopped, and he looked at me, and I thought, uh-oh, what's going to happen now? And he goes, you'll help more people if you're famous. I thought, so maybe if you're rich, you could help more people. I hope it works that way. I had a few other ideas. Yeah, I think so. And if you can't save a life, you can improve a life. And in fact, some of the people I think I've helped the most are people whose child has died, but they really needed support during the whole process. So maybe not everyone can be saved, but everyone can be helped. You see that nuclear power plant. Think about it. Not like the bad kind that gets tsunami, but like the good kind, the ones in Germany or whatever. So this is what happens in every country that's high-income country. 100 children develop cancer. 99 of them get diagnosed. 98 of them get a correct diagnosis. So we lose one, didn't get diagnosed. That's the red. We lose one more, the orange, got a wrong diagnosis. Then we lose 1% more who doesn't get the treatment. And lose another % who dies of toxicity, the blue. And then 15% relapse. So when you see that purple there, all of the problem, all the blue is cure. Great, 80% cure in high-income countries. But the people who are not cured in high-income countries, it's because they relapse, 15% relapse. And so when you see a research happening in high-income countries, it's always the same. Get rid of relapse or reduce the permanent side effects, because the survivors need to be healthy as well. If you look in low and middle-income countries, this is actually Cambodia right now today. You look at the no diagnosis, about 20% of children don't even get a diagnosis. Another 8% get the wrong diagnosis. So they're treated for one cancer, they had some different cancer, or some different problem, tuberculosis or something. Another 20% don't start treatment, the green, or they abandon the treatment before it's finished. And in blue, another 8% die of toxicity. And then purple. Even if you have all these other problems, you can still relapse. And in fact, people relapse more in low-income countries for many reasons. So if you compare these two, let's just put them side by side, these two histograms kind of tell you what the situation is, what you need to do. You need to find every color that's not blue and fix it, right? If it's blue, cured, great. But there's a lot more to fix over here on the right, abandonment, toxic death, and relapse. So for example, if you go work in some other country, or if you want to analyze your own data, I would challenge you to always structure your data like Thank you. That's a good skill. My system is, I couldn't hear that it was gone, so bad system. So align with the core values and keep on following it. So my core value is to cure more children with cancer in the world, the whole world. And that means you got to work on the purple in the United States and got to work on every other color everywhere else. So integrating continuous quality improvement. What does that mean? This is my son when he was just learning what is a shoe. So quality improvement starts with curiosity. You have to wonder, why is something wrong? Why do people abandon the treatment? So let's just take Cambodia as a great example. Why do people abandon the treatment? In the United States, people abandon because they have unusual healthcare beliefs. And they say, I don't want chemotherapy, I want to smoke marijuana and hope for the best. And so it's belief in some herb might help me. In Cambodia, it's usually, I have to pay a fee for my blood test. I have to pay the bus ticket to go there. I have to pay a fee for my chemotherapy. I ran out of money. So it's not that they want to leave, it's they cannot afford to stay. So then you say, well, what do I do to help that patient? Well, maybe the hospital's already giving free chemotherapy. Maybe a free bus ticket could do the trick. I'll show you in a second. So here's the good news. Every color on this chart, like not getting a diagnosis, it's not just one thing, it's a series of things. For example, maybe lack of awareness of the parents, so they don't bring the child to the doctor. Or maybe that they bring the child to the doctor and the doctor says, it's just a lymph node, you've got an infection. I manage a lot of Hodgkin lymphoma. The average patient has had 4 treatments with antibiotics before they come and get a biopsy. And that's normal, right? But some countries, you get 6 treatments with antibiotics, 10, 20, and you never come, and that's the patient who dies without a diagnosis. Same thing for misdiagnosis. There's all these sub-causes, and there's all these strategies. Same for abandonment. Look at all the different reasons people abandon the treatment. Like, miss their appointment, nobody calls. They miss the next appointment, nobody calls. Then they think, oh, well, maybe it wasn't that important. Nobody calls. I had cancer in my eye. I had a melanoma in my eye, and I missed several appointments, like several, and nobody called me. And luckily, my wife was nagging me, hey, you should go there and, get cured. I said, all right. I missed follow-up. I didn't miss treatment. I missed the follow-up. So just like one CT scan was 1 year late, just to give you an example. So my best friend would have said, hey, just go do it. I was busy, so I didn't go. But maybe you should have gone. So the best friend would say, take time, take care of yourself for just 1 minute. One CT scan, is it so hard? Toxic death. Oh my goodness. Toxic death is a huge problem because infection is the #1 cause of toxicity in almost every cancer treatment. And if the supportive care is not ready, some patients die. And then relapse. Look at all these sub-causes. Lack of access to chemotherapy, low-quality chemotherapy, asparaginase, for example. Many countries are buying a bad asparaginase that's really almost useless. So useless, in fact, that in some countries it's been studied, and they studied the asparaginase bottle, and there was no asparaginase inside, only broken fragments of asparaginase and some bacteria, just to round it out. So it's really a problem, and I would encourage you to please take a picture of your asparaginase and email it to me, because we're doing a global study of quality and looking, a lot of times, asparaginase that you know is bad in Georgia is still being bought in Armenia. Very common. Sometimes it even has the same name, same brand, everything the same. Very obvious. So all these problems, you think, how many problems could we have? And if we had a goal, our goal might be, let's solve one problem. But if we have a system, the system is so much better. Because the system is, I'm always looking, always looking. When I see something preventable, let's work on that and prevent it. And when I see 45 things, don't work on 45 things. Work on 1, work on 2, maximum 3. but 2 is better. 1 is ideal. So part of the system is focus on 1 or 2 issues that you know you can do. So sometimes people say, well, the government should buy a better asparaginase. I don't have any power over the government. That's nothing I can do. Are you going to show me cards? Or just do Twitch, if it's, yeah. So I can't change the government of the United States. Not at all. I can vote, 1 vote out of 300 million. So I really can do nothing. I can't change the president, anything. But I can set up a lab to measure asparaginase activity. I can do that. I myself can do that. I don't know how to do it now, but I can read and I can check it out and do it. So maybe that could be my project for the year. Set up a quality and measure the quality. Somebody else's job can be go show that to the government. Maybe they know the government. Somebody can do that. So lots of things to work on, and relapse is really the most difficult. So precision medicine is so important. I'm glad we had a whole session on this. I wish everybody could get the precision medicine. Until that day comes, though, what I would like everyone to do is to join the research network, the Resonance Research Network. So Resonance is my organization. We have a research network for one reason, to attract studies so patients can get access to study drug. Because study drug now can be really life-saving. Like larotrectinib, you go from very bad outcome to 100% event-free survival with certain cancers. Just if you have it, you're cured. If you don't have it, you're not. Arsenic trioxide, same thing. So access is what we're going for now, and one way to get access is by an active research program. Toxic death, nothing we can do about that with research except improve the supportive care. Again, though, toxic death, what a great project for people in training. He's winning. So for people in training, toxic death would be the way to go, right? You could study how long does it take when they get their fever, how long does it take to give the first antibiotic. I hope you heard Sheena Mukata talking about this in the other session. Abandonment, big problem. Turns out that's the one I worked on. First thing in my own life was abandonment. And what we did was studied abandonment in Brazil. And why? Because we found that, you know, that cure gap between high-income country and low-income country? In Brazil, in this one place in Brazil, they were using the same exact protocol that we had at St. Jude. Same, every medicine the same, every day, every dose of the whole 3 years of treatment. And at St. Jude, we were getting 80%, and they were getting 32% with the same exact thing. And so the question was, what should we do now? Should we change to the new St. Jude protocol? And the answer is, well, let's first find out what's in the gap. What's the difference there? And so working with the head oncologist and his wife, who is the head psychologist, they already knew one problem was abandonment of treatment. What did they do about it? Well, they made this building. This is the headquarters building. The first floor is headquarters. All the rest, apartments for the families. Any family who lived out of town, they stay there for free. They have food there. Then they put the physical therapist there because they would go to the hospital to wait for the physical therapist and then be sitting next to infected people and get infected. They said, why don't we put the physical therapist in the house? So they go home early from their chemo and then get physical therapy right there, and they can play while they're waiting for their turn. And dentist, and free food, and free transportation, and bus ticket. And their abandonment went down like crazy from 16% to 1% to 0.5%, and now 0% in the last 4 years. So what they showed was that you can eliminate abandonment even if the family is very poor. And when they did their first study, they did a survey, and they asked the parents, why did you not bring your child back for the treatment? And the parents, a lot of the parents said, I'm trusting in God. So in the database, they put religious reason for abandonment. I'm trusting in God instead of chemotherapy. But when they had a free bus ticket and had a free housing, suddenly, so that's when the guy said, we did the database wrong. Because, of course, if you have no bus ticket, you just trust God. What else are you going to do if you can't get on the bus? If you have no housing and you're sleeping on the street with your child who has cancer, you say, no, I'm just going to go home and trust God. But it doesn't mean you don't believe in chemotherapy. It means you have no choice. So when they were given a choice, people came. And he said he also liked this study because he said, some stupid people told me, if you have 8 children, maybe if one dies, you have 7 left. So it's okay, because sometimes the biggest families had more risk to abandon treatment. But it's because the biggest families were the poorest families, and they had less money to buy the bus ticket. And who's going to take care of the other 7 when I'm taking the sick one for their treatments? So he said he proved with this strategy that people actually even love the 8th child. So hard to believe? No, not hard to believe. He said, but I couldn't prove it, and now he's proved it, that that was stupid, that idea. So my organization offers a free database, free medical record, free patient tracking system. The patient tracking system, I really think you should use this, actually, Mariko. The patient tracking system basically tells you everybody who's supposed to come, and if they don't come, you just click when they come. Yes, yes, yes. And you can click and say, click and schedule, so you have them on the schedule for next time. And then at the end of the day, whoever didn't come, they need a phone call. If they hear from you the same day, look what happened in El Salvador. It's called the Residence Patient Center, because the patient is at the center. Because that's my personal goal. My nuclear reactor inside me is to put the patient at the center and try to cure them. And here's what they did. They had one social worker for 1,000 patients. So they couldn't afford to buy a second social worker. But they gave the social worker better tools, and the social worker started calling people same day. Abandonment went down in El Salvador, 12% down to 2% with this one intervention. Then they did a whole bunch of other things to try for the 2%. They're still working on the 2%, to be honest. The 2% is hard. So, to wrap it up, no, I have one more minute. Systems involve everyone, and publishing the results gets everyone excited. So this is Catherine Lam. She is at St. Jude, part of St. Jude Global, working in the Asian region, including Cambodia. So you've met before, maybe. Okay, good. So she and I worked together a lot on abandonment, and she actually defined abandonment because people would say all kinds of things. The patient ran away, the patient refused treatment, all this. So I call this semantic chaos. One of these, look at this, the patient was out of control. So out of control is one thing, abandonment is another. So she actually organized this into every problem with treatment completion, and then made a little flowchart so you could actually define abandonment. It's hard to improve something if you don't know what it is, if you can't measure it. They always say, well, you can't improve what you can't measure. So she fixed all that. And then one nice thing that resulted from this project, we ended up getting married. So that's my wife, actually, Catherine. That's like 100 years ago when we were both very small. So relapse is a big problem, but abandonment is super preventable, really preventable in every country. And to cure these relapses, my dream is everyone participating in a research study where they get a free study drug and where people provide funding for the data management, so they get the study drug, and where that data goes to the whole world. Because I don't have any problem with investing money and energy to cure children in the United States. Rich children also need to be cured, and poor children and everybody. But the first step for me is get that blue curve up. Let's cure everybody that we know we can cure, and then let's get to everybody else and get to 100%. So I really appreciate the invitation, and I really appreciate you letting me start off this session.
Thank you very much for your inspirational and motivational talk, and thank you for being here. So I will introduce our next speaker. It would be very difficult to introduce him just in one sentence, so please welcome Dr. Guillermo Chantara, the president of SIOP, and welcome.
Oh, thank you very much, Shushan. It's a great pleasure being here with you today. I would just give a couple of thoughts for young investigators. I will start with a brief biography just to put you in context, because I think there are many things that happen in our lives besides our career, and these things influence a lot our career choices. So a few words about me. I am 50 years old, okay. And I was trained in Argentina, in Buenos Aires, where I lived for 31 years or so. I became a pediatric oncologist. I did my PhD thesis. I was quite old. I was 41 years old, I think, when I did my PhD. I was the only one with gray hair. And I had a number of occupations and works. I worked as a contractor at St. Jude. I work at the Garrahan Hospital in Argentina. I mostly took care of patients with retinoblastoma, non-Hodgkin's lymphoma. I did bone marrow transplantation as well for 7 years when I have to confess I did it for the money. It was not because I wanted to get rich, it's because I had a family, I had to feed my family, and that was the best choice at that time. And now I work in Barcelona as the head of the international outreach program of the hospital. I am also married with the same wife for forever, and she's also MD, PhD, and she's also a hematologist, so it's quite complicated when it comes to platelets. And I have 2 daughters, one of them, she's a medical doctor as well. And the other one is a chef. So I'd like to tell you that I think Scott mentioned that there is no straight line. Whenever I hear these TED Talks that's all fancy with a straight line showing the road to success, etc., that really doesn't exist. And the proof of that, this is, I put my name in PubMed last week when I did the slide, and you can see here, even though, as Scott said, that the trend can be, where is the pointer? Is this? The trend is high. You see that there are many up and downs, probably related to the birth of one of your children, losing one job, sometimes opportunities, and taking the SIOP presidency will start putting my production low because I have to work a lot more on SIOP. So there is, oh good, thank you. So I think a very important question that you ask yourself is usually, how do I get started? Because sometimes this is something that you look for it, sometimes it's something that just happens in your life. So I put a couple of examples. The first thing, if you want to be a researcher, is that you have to read a lot. This is a very lonely life. If you don't like to read, if you are not a big reader in your career, you may still be a good researcher, but you need to change, as Scott said. You have to put your set, you say, I have to read. Because for being a good researcher, you have to be a very good reader and a passionate reader. And importantly, you have to meet the key people. Fortunately, I was very lucky and I had many key people in my life, but that is not a passive attitude. You have to look for the really key people, and you need to be clever and take the opportunities to identify who the key people in your life is. I mean, in your professional lives. And also, you have to decide to work a lot. If you don't like to work a lot, the research career is not for you. You have to work a lot by unpaid work. It's not that you will charge by the hour when you read papers and you use your protected time. I don't like the word protected time. I think the only thing I would be protected is from reviewers, but that is not possible. No one gave me that option yet. And you have to be decided of solving problems. At least when you are a researcher in medicine, probably in pediatric oncology, you have to be interested in solving a problem. You need to save lives, as Scott said. You need to be, it's not because I like, I want to solve a problem. I want more children to get cured. I want more children to suffer less. And for those that don't speak English as native language, these are key things. You have to speak English. And you have to write English, or at least something that could be similar to English. And it's not that because sometimes it happened to me that people that like to start doing research, they say, oh, I will do research, so I will take a course on biostatistics. Oh no, that is not the starting point. You are probably going to get bored. It is not that you need to know every formula in statistics, you just need to know to apply some test and to think, and you like the numbers. And right now you can get a lot of help with just one computer and a mentor. And also, I think for those that live not in Western Europe and the US or in Canada, it's a good idea to spend some time in a big center in in these countries. For many reasons, because probably you would improve your English, the density of intelligent people in those centers is really extremely high. You're going to come up with a lot of intelligent people. You will learn a lot. You will learn the thinking of a different way. So everyone I know that had a successful career in a low and middle income country spent some time in a major referral institution in Europe or in the US. The importance of mentors, Scott told that these are people that you don't know, you don't care, but they are really my mentors. One of them is an ophthalmologist. I'm not, I'm pediatric, I'm only pediatric oncology, so you have to be very open-minded in who is your major mentor. That was the day when I got my PhD thesis, when I invited Dr. Abramson, who flew to Argentina just for one day. He listened to my presentation. I get back to New York. And this was Dr. Schwartzman that he introduced me in the world of retinoblastoma. As Scott said, be prepared for rejection. When I met him, he was already running a protocol for retinoblastoma. I was a third-year fellow. He was treating 100 patients in his protocol. No data analyzed. He didn't know anything about Excel or something. Excel didn't exist at that time. I had the chance of doing the database, writing the papers, send it to publication. I was so naive that I sent it to JCO because I think the paper was great. And that time, internet didn't exist, so we received a letter. And the letter said, Dear Dr. Schwartzman, the paper is not accepted. It is not acceptable, so he threw away the letter. So I went to the, I didn't believe, so I just went to his office, took the garbage away. I looked for the letter, and the letter said, the paper is not acceptable in this form, but if you do the following changes, we may consider the paper. We did it, and we published the paper in JCO. So he was a really good mentor for me. He gave everything for me to be a specialist in retinoblastoma. So there is another question that I think is really critical. Is it curiosity or is still opportunity-driven research? It is probably both. I always said I was not born to be interested in retinoblastoma. Probably I was involved in retinoblastoma because of Dr. Schwartzman, probably because I was not clever enough to do leukemia, but still it was difficult. It had a lot of genetics, so opportunity is really important. He was there. He was there. He wanted to teach me. He was about to retire. His patients were going to be free for me to do the job, so that is very important in your career. So you have to be flexible. It's not dogmatic to say, oh no, I just want solid tumors, retinoblastoma, alveolar tumors, otherwise I would not do any research. That's not the situation, at least in our setting, because the opportunities come. And also, but it's opportunity, but without curiosity, as Scott said, it's not. If you're not curious, if you don't doubt about the results, if you are not thinking why this is going to happen, research is not going to be fun for you, because research has to be fun. And if you're not curious, I think it's not so fun. And this is very critical for us. When I was your age, I always thought, oh, I will try to analyze my data so I can show that they are similar to the US or Germany. And that is not the point, because it is probably that they are not going to look good, as good as them. And what do many people do? They swipe under the carpet and say, oh, they look similar. P is not significant, so this might be the same as the results that we have in the US. And the most important thing is to concentrate in the difference, in the graph that Scott showed. Why things are different in my country, why I'm not seeing exactly what it is seen in the US or in Western Europe. And if you're interested more in the difference than in the similarities, I think that's a great first step in your investigator career. And it's good to have a wide range of topics, but I think at some time you have to focus. So it's not good that if you do a fellowship in palliative care, next week you do another fellowship in intensive care unit, then you go back and do leukemia, then CNS tumors, and then you come up with the, I always said the same phrase, I don't know if I'd like to buy a dog or become a researcher. So that is not a good idea. And also, you have to consider the place where you practice, because if you are interested in retinoblastoma, but you have 3 patients per year, probably it is not going to be very powerful, the research you do, if you do it yourself. You have to work with others. And it's really important to be surrounded by people that are very intelligent, that are much more intelligent than you. So for a successful research model, I think that these are the things that we need in our setting. It is not possible without NGO support. The government will not pay you to the research. Sometimes they do. My wife, for example, she's a researcher and applies for research grants by the state, but it's very, very difficult. You have to find some international support. This is very critical, but be careful. Not all the centers like it. Some countries are not very happy when you get support from the US or from Europe. So you have to be quite careful on that. You have to be a lot of relationship with academia. So the universities have to be there because it's very important for your PhD. And you need hospital resources. Again, if you don't have patients and you don't have the possibility of doing this research, probably you need to do some research that is transversal. So, for example, supportive care, for example, palliative care, not disease-oriented research. So some final thoughts. I think being a researcher is a way of life. It's not just a job. So be prepared for a lot of time of unpaid job. Be surrounded by very intelligent and smarter people, much smarter than you. That's the best thing of SIOP. Sometimes it's too much people. There are too many people that is smarter than you, and it's become overwhelming, but it's really great. Pay attention and try to work with the people that you like most and avoid toxic settings. If you're really interested in a disease, but the guy or the lady that is there is really very toxic, move away, go to another direction. The ocean is big. Why are you going to go to just that place where that person is? And as Scott said, be patient. This is about rejection. If you think that research is something that will inflate your ego, you're wrong. Most of the times, it is like Tinder. You're going to be rejected most of the times. And most of the times, reviewers are correct. And learn from the different point of view of other disciplines. So it's good if you work with ophthalmologists, with surgeons, with neurosurgeons, with basic biologists, with pharmacists, because they have different knowledge, they have a different point of view. And that is very, very enriching for you. And be open for new possibilities. I like this phrase of being 50-50 fox and hedgehog. The hedgehog will just stay inside, and the fox will wander around looking for the opportunities. 100% of each side is not so good, but make a good combination according to your personality. And align with your institution mission. That was very painful for me, that I had to stop my research career in one institution after 31 years, because sometimes my research path was not the same as a hospital. And again, you have to read and read and read and read. Thank you.
Thank you very much, Dr. Shantara. And please welcome SIOP Asia's 2023 Woman Leader, Dr. Mariko Kakazu, please.
Okay, thank you for giving me an opportunity to speak today. Actually, this is third presentation for me. And I have been working in Cambodia for over 5 years now as a member of Japanese NGO. Today, I'd like to talk about my career path and challenging. And this is my career path as a pediatric oncologist. Now, when I was 14 years old, my father died of brain tumor, so I decided to be a doctor to treat cancer at that time. And my hometown, Okinawa, is a very beautiful island in Japan, southern area, most southern tips, a small island, and very beautiful sea, but the medical situation not so good. So at the time, in the past, the survival rate of all diseases are not enough, inferior to mainland of Japan. So I want to improve this situation also. So I went to medical school in my hometown, and I continue practice. After when I was medical student, I had a patient who had brain tumor. He is 5 years old boy with brain tumor, and I visited him frequently after finish my internship, but he died after 1 year. So at the time, the pediatric oncologist doctors took care of him and his family so much. So I decided to be a pediatric oncologist. And during my training, my hometown situation getting better. In Okinawa, survival rate disease and improving. So now no gap between mainland of Japan. So, but at the time I had this survival gap of childhood cancer. This is a presentation by Dr. Scott Howard in St. Jude Viva Forum 2009. I had this knowledge from Miss Kazuyo Watanabe. She presented a lecture about this survival gap. So I decided to work in developed country to improve this survival gap. And after finish my training, and I start my work in hometown as a pediatric oncologist for 6 years. After that, during my staff doctor, I trained some young doctors, and I can finish my work in my hometown. And 2017, I joined Japan had an NGO, international NGO, to activity in Cambodia and Myanmar and Laos. They tried to start pediatric oncology world, pediatric world and pediatric oncology patient treatment in Cambodia. So I joined this Japan Heart activity. In 2018, we opened pediatric ward for pediatric oncology patient, and we accept patient every year. And now we have 100 cases per year. So now we have many limitations in this small hospital. We only have 40 beds, only 5 doctors, including me. So not enough for us. So we want to accept more patients. So we decided to open new hospital 2025. And this is our hospital result. We focus on solid tumor because other charity hospital only treated leukemia and retinoblastoma. So we have accepted 293 pediatric cancer patients in the past 5 years. Initially, the number of pediatric cancer patients was around 20 to 30 cases per year, but almost case, advanced case, or relapse case, or survival rate 20% at the time. But now, early diagnosis and the case, not fresh case coming these days. Now we have accept around 100 cases per year. And outcome of treated cases in our hospital, about 52% patient alive now. Wilms tumor, so good, excellent, over 80%. Lymphoma and germ cell tumor, over 60%. Hepatoblastoma and rhabdomyosarcoma, over 50%. But neuroblastoma, most neuroblastoma, high-risk patient, we don't have stem cell transplantation. So high-risk neuroblastoma, almost patient died. And 127 cases died. 48 patients died. Most of them died of tumor growth, but 6 died of complications like sepsis, heart failure, liver failure, and surgical complications. In order to accept more pediatric patients and improve survival rate, we decided to build a new hospital in 2025. Ministry of Health in Cambodia provided, they recommend to build a new hospital inside public hospital. So they provide a land inside public hospital. We can use this land. And we have a plan to prepare 200 beds for general pediatrics and surgery and oncology patients. And now we don't have CT scan, but the new hospital has CT scan and blood transfusion unit also. So we have planned to accept patients not only in Cambodia, but also from Myanmar and Laos, because Myanmar now under very severe situation in Myanmar. We have a branch in Myanmar, but in Myanmar, oncology patients now in children's hospital, Yangon and Mandalay, only 30% staff can work now. So they have so much limitation. So we decided to accept patients from Myanmar too. And about challenging in my career, when I joined medical activity in Cambodia 6 years ago, there was not enough infrastructure such as electricity, water, and road, and the power was cut every day. So we didn't have any information about chemomedicine in Cambodia, so we have to find medical supplies by ourselves. I and my staff go to visited pharmacy to find chemomedicine at the time. And misconception is very challenging for us. Both patient families and local healthcare professionals, but even doctors had a misconception that cancer cannot be cured. So we usually provide treatment free of charge, but some family refuse treatment and they returned home. So, and cultural differences were another challenge. Inadequate, the doctors in Cambodia, sometimes Japanese doctors work in too much, but they said it's crazy. Oh, no lunchtime? It's no, ridiculous. So they need lunchtime, they need day off. So my first time, we have cultural differences with local staff. And sometimes they inadequate explanation for medical condition to a patient, and patient family want to know about their medical condition, but they didn't explain well that time, and sometimes not taking responsibility for their patients and making patients wait long time, lunchtime also. But to overcome this challenge, I try to seek and implement the best treatment, and even with limited resources, using books and literature, we search for treatment protocol arranged to developing countries, and decided to start treatment with drugs available in Cambodia. And we visited many major children's hospitals in Cambodia and explaining that treatment for childhood cancer is available in Cambodia. And we are able to build trust by accumulating patients who were treated and cured at our hospital. We also send out information on childhood cancer through SNS, social networking service like Facebook, and introduce patients who are cured to encourage people to believe that cancer can be cured. And we joined Cambodian Children's group in 2018, and we have weekly tumor board, patient referral, central pathology review, and sharing treatment protocol. And for cultural differences, we discuss with our staff. And we respect their culture because we work in Cambodia. We have to respect their culture. So we take a rest enough. They want to take a rest enough. So we follow them. We take 90 minutes lunchtime with them for Cambodian people, and Japanese staff also take lunchtime the same time. But we train our staff to take care of our patient with responsibility. And my motivation for pursuing my career is that this patient, all of these patients are picture of we couldn't not save in Cambodia. Over 120 patients died in past 5 years. They trust us and receive treatment, but we couldn't save them. However, most of the family thanks us for seeing them through to the end. So we couldn't save their lives, but we might be able to save their hearts. So we will improve ourselves for next patients. This is what motivates me. And this is last slide. My advice, same as before. My advice for young specialists in the following 3. First, always choose the more challenging path. If you have a choice, please choose the more challenging path. In my case, choosing rigorous training pro hospital and joining NGO activity, these are challenging choices. Even I failed, I have no regret. Please choose a path that you will not regret. And second, find mentors who suit you. It's very important to find a mentor who matches your personality and even not only medical specialist. Okay, I have 3 mentors now. This is my boss. She is not a, she's a internal infectious medicine doctor, and she is a senior doctor in my training hospital, and she's now my boss in NGO activity. And he's founder of my NGO hospital. He's a pediatric surgeon. He's great. He's very good at, especially fundraising. So I can learn about fundraising from him also. And third, Miss Kazuyo Watanabe, ACCL, whom I often, she is not a medical professional, but she's working in Vietnam long time to improve survival gap in Vietnam. So she's also my mentor. And third, treat yourself like your best friend. Let's be your own best friend. Would your best friend want you to work too hard and destroy your health? So when I was early 30s, I was so busy, and I drank alcohol so much to relieve my stress. So I have health problem at that time. But please treat yourself. But I changed my mind, and I treat myself like my best friend. So now I can take my time to stay healthy. So please treat yourself like your best friend. Okay. And my final word is do the right things, and the rest will follow. Thank you so much.
Thank you very much. I would like to express my deepest gratitude to all the speakers, attendees. I would say this is the most challenging session, as we are right before the gala reception. So looking forward to meet you there. And may I ask the speakers to have a photo together? Thank you.